1. What is the first priority in the management of a fresh surgical wound? A. Administer antibiotics. B. Assess for signs of infection. C. Control bleeding. D. Change the dressing. Answer: C. Control bleeding. Rationale: the first priority in managing a fresh surgical wound is to control any active bleeding. This ensures the wound site is stable before proceeding with further interventions like dressing changes or antibiotics. The other options are important but secondary to controlling bleeding. 2. Which of the following factors may delay wound healing? A. Adequate nutrition. B. Good blood supply. C. Chronic diseases such as diabetes. D. Proper wound care. Answer: C. Chronic diseases such as diabetes. Rationale: chronic diseases like diabetes can impair circulation and immune response, which can delay wound healing. Adequate nutrition, good blood supply, and proper wound care all support the healing process. 3. A patient presents with a deep wound that has clear, straw-colored exudate. Which phase of wound healing is most likely occurring? A. Hemostasis phase. B. Inflammatory phase. C. Proliferative phase. D. Maturation phase. Answer: C. Proliferative phase. Rationale: the proliferative phase involves tissue formation and new blood vessel growth, where clear or straw-colored exudate is common. The other phases are not as consistent with this type of exudate. 4. What is the most common complication of a pressure ulcer? A. Hyperglycemia. B. Infection. C. Edema. D. Tissue necrosis. Answer: B. Infection. Rationale: infection is the most common complication of pressure ulcers due to prolonged exposure to moisture and bacteria. Tissue necrosis can occur but is a result of inadequate treatment or prolonged pressure. Hyperglycemia and edema are not primary complications of pressure ulcers. 5. Which type of dressing is most appropriate for a dry, necrotic wound? A. Hydrocolloid dressing. B. Transparent film dressing. C. Alginate dressing. D. Wet-to-dry dressing. Answer: A. Hydrocolloid dressing. Rationale: hydrocolloid dressings are ideal for dry, necrotic wounds as they promote moisture retention and autolytic debridement. Transparent film dressings are typically used for shallow wounds, alginate dressings for wounds with heavy exudate, and wet-to-dry dressings are used for mechanical debridement. 6. Which of the following is the most important factor in preventing pressure ulcers in a hospitalized patient? A. Repositioning every 2 hours. B. Applying a pressure-relieving mattress. C. Ensuring adequate hydration. D. Giving pain medication regularly. Answer: A. Repositioning every 2 hours. Rationale: repositioning patients every 2 hours is the most effective way to relieve pressure on vulnerable areas and prevent pressure ulcers. Although other interventions like hydration and specialized mattresses are important, repositioning is critical. 7. Which type of wound is characterized by full-thickness tissue loss with exposed muscle or bone? A. Stage I pressure ulcer. B. Stage 2 pressure ulcer. C. Stage 3 pressure ulcer. D. Stage 4 pressure ulcer. Answer: D. Stage 4 pressure ulcer. Rationale: a stage 4 pressure ulcer is a full-thickness wound that involves muscle or bone exposure. Stage I is characterized by redness. Stage 2 involves partial thickness loss, and Stage 3 shows full-thickness skin loss without muscle or bone exposure. 8. What is the primary goal in treating a wound infected with methicillin-resistant Staphylococcus aureus, MRSA? A. Apply a wet-to-dry dressing. B. Use antibiotics as prescribed. C. Increase nutritional intake. D. Reposition the patient every 2 hours. Answer: B. Use antibiotics as prescribed. Rationale: treating MRSA requires appropriate antibiotics, as it is resistant to certain antibiotics. The other options may aid in healing but are not the primary treatment for MRSA infection. 9. Which type of wound healing involves the wound edges being brought together with sutures or staples? A. Primary intention. B. Secondary intention. C. Tertiary intention. D. Inflammatory intention. Answer: A. Primary intention. Rationale: Primary intention occurs when wound edges are brought together, typically with sutures or staples, allowing for quicker healing with minimal scarring. Secondary intention involves healing from the bottom up, and tertiary intention involves delayed closure. 10. Which of the following is most effective in reducing the risk of wound infection in a patient with a diabetic foot ulcer? A. Frequent dressing changes. B. Restricting patient activity. C. Keeping the wound dry at all times. D. Proper blood glucose control. Answer. D. Proper blood glucose control. Rationale. Proper blood glucose control reduces the risk of infection by improving the immune response and circulation. While frequent dressing changes and proper wound care are also important, blood glucose control is key in preventing infection in diabetic patients. 11. What is the primary characteristic of a stage 2 pressure ulcer? A. Partial thickness loss of skin. B. Full thickness skin loss. C. Muscle and bone exposure. D. Redness with no open skin. Answer. A. Partial thickness loss of skin. Rationale. A stage 2 pressure ulcer involves partial thickness loss of the dermis, appearing as a shallow open ulcer with a red-pink wound bed. Stage 3 and 4 ulcers involve deeper tissue damage. 12. When caring for a patient with a surgical wound, which action should the nurse take to prevent infection? A. Cleanse the wound with hydrogen peroxide daily. B. Use sterile technique when changing the dressing. C. Apply a tight dressing to minimize air exposure. D. Discontinue antibiotics after the wound appears healed. Answer. B. Use sterile technique when changing the dressing. Rationale. Sterile technique is essential for preventing infection when caring for surgical wounds. Hydrogen peroxide may damage healthy tissue, and tight dressings can create a moist environment that promotes infection. Antibiotics should be used according to the healthcare provider's orders. 13. Which of the following is the most appropriate intervention for a patient with a dry, necrotic wound? A. Apply a hydrocolloid dressing. B. Clean with hydrogen peroxide. C. Use a wet-to-dry dressing. D. Apply a transparent film dressing. Answer. A. Apply a hydrocolloid dressing. Rationale. Hydrocolloid dressings promote moisture retention and autolytic debridement, which is ideal for dry, necrotic wounds. Hydrogen peroxide can damage healthy tissue, while wet-to-dry dressings are used for debridement of necrotic tissue in moist wounds. 14. A wound with red, beefy granulation tissue is most likely in which phase of healing? A. Hemostasis phase. B. Inflammatory phase. C. Proliferative phase. D. Maturation phase. Answer. C. Proliferative phase. Rationale. The proliferative phase involves the formation of granulation tissue, which appears red and beefy. This phase focuses on tissue regeneration and revascularization. The inflammatory phase involves swelling and redness, but not granulation tissue. 15. A nurse is caring for a patient with a large pressure ulcer. What is the priority nursing intervention? A. Apply a pressure-relieving mattress. B. Administer pain medications as needed. C. Clean the ulcer with saline. D. Reposition the patient every 2 hours. Answer. D. Reposition the patient every 2 hours. Rationale. The priority intervention for pressure ulcers is to relieve pressure by repositioning the patient frequently. While pain management and proper dressing care are important, preventing further pressure damage is the top priority. 16. A patient has a wound with purulent drainage and increased redness around the wound site. What is the nurse's first action? A. Administer pain medication. B. Assess the patient's vital signs. C. Cleanse the wound with saline. D. Notify the healthcare provider. Answer. B. Assess the patient's vital signs. Rationale. The first action is to assess vital signs to determine if the patient is showing signs of systemic infection. Afterward, the wound should be cleansed and the healthcare provider should be notified. 17. Which of the following is a sign of wound infection? A. Decreased swelling around the wound. B. Clear, watery drainage from the wound. C. Increased redness and warmth around the wound. D. Pale, dry wound edges. Answer. C. Increased redness and warmth around the wound. Rationale. Increased redness and warmth are signs of infection, indicating inflammation and possible bacterial involvement. Clear, watery drainage is normal in healing, and pale, dry wound edges suggest poor circulation. 18. A nurse is caring for a patient with a venous ulcer. What is the most important aspect of management? A. Elevating the legs to reduce edema. B. Encouraging ambulation to improve circulation. C. Using a dry dressing to absorb exudate. D. Applying pressure to the ulcer to stimulate healing. Answer. A. Elevating the legs to reduce edema. Rationale. Elevating the legs reduces venous pressure and edema, which is essential for healing venous ulcers. While ambulation is important for overall circulation, elevation is the most effective intervention for venous ulcers. 19. A patient has a diabetic foot ulcer. Which of the following actions is most important to prevent complications? A. Keep the foot elevated at all times. B. Inspect the foot daily for signs of infection. C. Apply ice packs to reduce swelling. D. Limit movement to avoid further injury. Answer. B. Inspect the foot daily for signs of infection. Rationale. Daily foot inspection is crucial for detecting early signs of infection in diabetic foot ulcers, preventing complications. Elevation, ice, and limiting movement are secondary interventions. 20. Which type of wound dressing is most appropriate for a wound with moderate to heavy exudate? A. Hydrocolloid dressing. B. Foam dressing. C. Transparent film dressing. D. Alginate dressing. Answer. B. Foam dressing. Rationale. Foam dressings are highly absorbent and ideal for wounds with moderate to heavy exudate. Hydrocolloid and transparent film dressings are more suitable for dry wounds, and alginate dressings are typically used for wounds with heavy drainage and necrotic tissue. 21. A nurse is caring for a patient with a pressure ulcer. Which of the following interventions should the nurse prioritize? A. Administering antibiotics. B. Encouraging a high-protein diet. C. Repositioning the patient every 2 hours. D. Keeping the wound dry at all times. Answer. C. Repositioning the patient every 2 hours. Rationale. Repositioning every 2 hours is the most effective method to relieve pressure on vulnerable areas, preventing further ulcer development. While nutrition and infection prevention are important, repositioning is key to pressure ulcer management. 22. A nurse is caring for a patient with a stage I pressure ulcer. Which of the following is the most appropriate intervention? A. Applying a hydrocolloid dressing. B. Administering pain medication. C. Repositioning the patient every hour. D. Cleaning the wound with hydrogen peroxide. Answer. C. Repositioning the patient every hour. Rationale. Stage I pressure ulcers are characterized by non-blanchable redness. Repositioning frequently helps relieve pressure and prevent progression of the ulcer. Hydrocolloid dressings are used for more advanced ulcers, and hydrogen peroxide can harm healthy tissue. 23. When caring for a patient with a burn injury, what is the priority goal of nursing care during the acute phase? H. Pain management and fluid resuscitation. B. Preventing infection and promoting skin integrity. C. Providing emotional support to the patient. D. Teaching the patient about home care after discharge. Answer. 8. Pain management and fluid resuscitation. Rationale. The acute phase of burn care focuses on stabilizing the patient through pain management and fluid resuscitation. Infection prevention and skin integrity are ongoing concerns, but stabilization is the first priority. 24. A patient with a pressure ulcer has been placed on a specialized mattress. Which of the following is an additional intervention that would be most beneficial? A. Reducing the patient's fluid intake. B. Encouraging frequent ambulation. C. Repositioning the patient every 2 hours. D. Applying a transparent dressing over the ulcer. Answer. C. Repositioning the patient every 2 hours. Rationale. Even with a specialized mattress, repositioning every 2 hours is essential to relieve pressure and promote healing. Ambulation may not be appropriate for all patients, and fluid intake and dressings should be managed based on wound status. 25. What is the most appropriate dressing for a wound with large amounts of exudate and no necrotic tissue? A. Hydrocolloid dressing. B. Transparent film dressing. C. Foam dressing. D. Alginate dressing. Answer: C. Foam dressing. Rationale: foam dressings are highly absorbent and work well for wounds with significant exudate but no necrosis. Hydrocolloid and transparent film dressings are more suitable for dry wounds, while alginate dressings are used for wounds with necrotic tissue. 26. A nurse is caring for a patient with a surgical wound and serosanguinous drainage. What is the most appropriate nursing intervention? A. Change the dressing every 4 hours. B. Notify the physician about the drainage. C. Monitor for signs of infection. D. Apply a hydrocolloid dressing. Answer: C. Monitor for signs of infection. Rationale: serosanguinous drainage is a normal part of wound healing. Monitoring for signs of infection is important, but there is no immediate need to notify the physician unless the drainage becomes purulent or the wound shows signs of infection. 27. Which of the following factors is most important in preventing wound infection? A. It's proper nutrition and hydration. B. Frequent dressing changes. C. Using antiseptic solutions on the wound. D. Providing the patient with pain relief. Answer: A. Proper nutrition and hydration. Rationale: proper nutrition and hydration support the body's immune system and enhance wound healing, which are crucial for preventing infection. While other factors are important, nutrition and hydration are foundational. 28. A nurse is caring for a patient with a venous ulcer. Which of the following interventions should the nurse implement? A. Elevating the leg to reduce edema. B. Applying compression stockings to the leg. C. Keeping the leg flat to promote circulation. D. Massaging the ulcer area to improve blood flow. Answer: A. Elevating the leg to reduce edema. Rationale: elevating the leg helps reduce venous pressure and edema, which is essential for venous ulcer healing. Compression stockings and other measures may be used later, but elevation is the first priority. 29. Which of the following is a sign of wound infection? A. Increased warmth and redness at the wound site. B. A decrease in wound exudate. C. A dry wound bed with no drainage. D. Granulation tissue formation. Answer: A. Increased warmth and redness at the wound site. Rationale: increased warmth and redness are signs of infection and inflammation. A decrease in exudate or dry wound bed may indicate that healing is progressing, and granulation tissue formation is a normal part of wound healing. 30. A nurse is preparing to change a patient's dressing after a surgical procedure. Which action should the nurse take first? A. Apply clean gloves to remove the old dressing. B. Clean the wound with an antiseptic solution. C. Assess the wound for signs of infection. D. Obtain a sterile dressing kit. Answer: C. Assess the wound for signs of infection. Rationale: the first step in dressing change is to assess the wound for infection or other complications. This allows for an appropriate plan of action, including the selection of dressing materials. 31. Which of the following is the most appropriate intervention for a patient with a stage 3 pressure ulcer? A. Apply a dry dressing. B. Administer pain medication as ordered. C. Clean the ulcer with hydrogen peroxide. D. Keep the ulcer open to air for faster healing. Answer: B. Administer pain medication as ordered. Rationale: pain management is critical for patients with stage 3 pressure ulcers due to the depth of tissue damage. Other interventions include proper dressing and infection prevention, but pain relief is essential for patient comfort and healing. 32. What is the primary goal when treating a patient with a diabetic foot ulcer? A. Controlling blood glucose levels. B. Increasing mobility. C. Maintaining a strict bed rest regimen. D. Applying a pressure dressing to the wound. Answer: A. Controlling blood glucose levels. Rationale: maintaining controlled blood glucose levels is critical to wound healing and infection prevention in diabetic patients. While other interventions like mobility and dressing care are important, glucose control is the priority. 33. A patient with a stage 4 pressure ulcer has a foul-smelling discharge from the wound. What is the nurse's first action? A. Change the dressing and apply an antibiotic ointment. B. Notify the healthcare provider. C. Cleanse the wound with hydrogen peroxide. D. Administer pain medication to the patient. Answer: B. Notify the healthcare provider. Rationale: foul-smelling discharge is indicative of infection, and notifying the healthcare provider is necessary to assess the need for antibiotics or further intervention. 34. What is the most important factor to consider when selecting a dressing for a wound with minimal drainage? A. Moisture retention. B. Absorption capacity. C. Debridement ability. D. Non-adherence to the wound. Answer: A. Moisture retention. Rationale: for wounds with minimal drainage, a dressing that retains moisture is ideal to promote healing. Absorption and debridement are important for more exudative or necrotic wounds, and non-adherence is a concern for all dressing types. 35. A nurse is assessing a patient's wound and notices that the wound has a red, beefy appearance with granulation tissue. What phase of wound healing is the wound most likely in? A. Inflammatory phase. B. Proliferative phase. C. Maturation phase. D. Hemostasis phase. Answer: B. Proliferative phase. Rationale: the proliferative phase is characterized by the formation of granulation tissue, which appears red and beefy. This phase focuses on tissue growth and wound contraction. The inflammatory phase occurs first, and the maturation phase follows after. 36. What is the most appropriate dressing for a wound with necrotic tissue and moderate exudate? A. Foam dressing. B. Hydrocolloid dressing. C. Alginate dressing. D. Transparent film dressing. Answer: C. Alginate dressing. Rationale: alginate dressings are highly absorbent and are ideal for wounds with necrotic tissue and moderate exudate. Foam and hydrocolloid dressings are better for less exudative wounds, and transparent film is used for dry wounds. 37. A nurse is caring for a patient with a surgical wound. Which of the following is a sign that the wound is healing appropriately? A. The presence of serous drainage. B. Redness and swelling around the wound. C. A thick, yellow discharge. D. Granulation tissue formation. Answer: D. Granulation tissue formation. Rationale: granulation tissue is a key indicator that healing is progressing and the wound is moving into the proliferative phase. Serous drainage is normal, while thick, yellow discharge and redness/swelling may indicate infection. 38. A patient with a wound on the leg has swelling and redness around the wound site. Which of the following actions should the nurse take first? A. Apply a pressure dressing to the leg. B. Administer prescribed antibiotics. C. Elevate the leg to reduce swelling. D. Cleanse the wound with antiseptic solution. Answer: C. Elevate the leg to reduce swelling. Rationale: elevating the leg helps reduce swelling and improve circulation, which is essential before addressing other aspects of care. The other actions can follow after assessment of the wound. 39. Which of the following is a common complication of untreated or poorly managed pressure ulcers? A. Hypertension. B. Osteomyelitis. C. Diabetes. D. Atrial fibrillation. Answer: B. Osteomyelitis. Rationale: osteomyelitis, or bone infection, is a common complication of deep, untreated pressure ulcers, particularly those reaching stage 3 or 4. Hypertension, diabetes, and atrial fibrillation are not typical complications of pressure ulcers. 40. Which of the following should the nurse educate a patient with a venous ulcer about? 8. Keeping the leg elevated and using compression stockings. B. Avoiding all physical activity to prevent injury. C. Keeping the wound exposed to air for faster healing. D. Decreasing fluid intake to prevent swelling. Answer: A. Keeping the leg elevated and using compression stockings. Rationale: elevation and compression stockings are important to manage venous ulcers by reducing swelling and improving circulation. Avoiding physical activity and keeping the wound exposed are not beneficial, and fluid restriction is not indicated. 41. A nurse is caring for a patient with a deep, full-thickness wound. Which of the following types of dressings is most appropriate for this wound? A. Transparent film dressing. B. Hydrocolloid dressing. C. Gauze dressing with antiseptic. D. Alginate dressing. Answer: D. Alginate dressing. Rationale: alginate dressings are best for deep, full-thickness wounds as they absorb exudate and promote healing by providing a moist environment. Other options may not be as effective for deeper wounds. 42. A nurse is teaching a patient with diabetes how to care for a foot ulcer. Which of the following statements by the patient indicates a need for further teaching? A. I will inspect my feet every day for signs of infection. B. I will wear tight-fitting shoes to prevent friction. C. I will keep my feet clean and dry, especially between the toes. D. I will report any redness, swelling, or drainage to my healthcare provider. Answer: B. I will wear tight-fitting shoes to prevent friction. Rationale: tight-fitting shoes can cause friction and worsen foot ulcers. Proper footwear should be comfortable and not cause pressure or friction. The other statements demonstrate appropriate foot care practices for a diabetic patient. 43. A nurse is caring for a patient with a pressure ulcer. The wound is covered with black eschar. What is the most appropriate nursing intervention? A. Apply a hydrocolloid dressing. B. Perform sharp debridement. C. Administer antibiotics. D. Apply a foam dressing. Answer: B. Perform sharp debridement. Rationale: black eschar indicates necrotic tissue, and sharp debridement is necessary to remove it and promote wound healing. Hydrocolloid dressings are not used on necrotic tissue, and antibiotics are used if infection is present. 44. A nurse is caring for a patient with a stage 2 pressure ulcer. What is the most appropriate action to promote healing of the ulcer? A. Apply a hydrocolloid dressing to keep the wound moist. B. Keep the wound dry to prevent further damage. C. Apply an antibiotic ointment to the wound. D. Massage the surrounding tissue to increase circulation. Answer: A. Apply a hydrocolloid dressing to keep the wound moist. Rationale: hydrocolloid dressings promote a moist environment that supports wound healing in stage 2 pressure ulcers. Keeping the wound dry or massaging the surrounding tissue could damage tissue and hinder healing. 45. A nurse is assessing a wound on a patient with an infected incision. The wound is red, swollen, and producing a thick, yellow-green drainage. What is the nurse's priority action? A. Administer a dose of pain medication. B. Cleanse the wound with saline solution. C. Notify the healthcare provider. D. Apply an antimicrobial dressing. Answer: C. Notify the healthcare provider. Rationale: the thick, yellow-green drainage and signs of infection require the healthcare provider's evaluation for possible changes in the treatment plan or the need for antibiotics. 46. A nurse is caring for a patient with a venous ulcer. Which of the following interventions is most important in promoting healing? A. Applying compression stockings to the affected leg. B. Elevating the affected leg above heart level. C. Administering antibiotics as prescribed. D. Keeping the wound open to air. Answer: A. Applying compression stockings to the affected leg. Rationale: compression stockings help promote venous return and reduce swelling, which is critical for healing venous ulcers. Elevation and antibiotics are also important, but compression is the most essential intervention. 47. A nurse is caring for a patient who has a large wound with a moderate amount of drainage. Which of the following dressings is most appropriate? A. Hydrocolloid dressing. B. Transparent film dressing. C. Alginate dressing. D. Foam dressing. Answer: D. Foam dressing. Rationale: foam dressings are highly absorbent and suitable for wounds with moderate drainage. Hydrocolloid dressings are better for dry wounds, while alginate dressings are used for wounds with heavy exudate. 48. A nurse is caring for a patient with a pressure ulcer. The ulcer is painful and shows signs of infection. Which of the following is the priority intervention? A. Clean the ulcer with hydrogen peroxide. B. Administer pain medication as prescribed. C. Increase the patient's fluid intake. D. Apply a hydrocolloid dressing. Answer: B. Administer pain medication as prescribed. Rationale: pain management is the priority to ensure patient comfort while other interventions, such as wound care, are also performed. Hydrogen peroxide may harm healthy tissue, and fluid intake is helpful, but not the priority. 49. A nurse is preparing to change the dressing on a patient's surgical wound. Which of the following actions should the nurse take first? A. Assess the wound for signs of infection. B. Gather the necessary dressing supplies. C. Clean the wound with an antiseptic solution. D. Remove the old dressing. Answer. A. Assess the wound for signs of infection. Rationale. The first step is to assess the wound for signs of infection to determine the appropriate care. Gathering supplies and removing the old dressing are subsequent steps. 50. A nurse is caring for a patient with a wound that has a large amount of necrotic tissue. Which type of dressing should be used? A. Hydrocolloid dressing. B. Alginate dressing. C. Transparent film dressing. D. Foam dressing. Answer. B. Alginate dressing. Rationale. Alginate dressings are highly absorbent and ideal for wounds with necrotic tissue. They help manage exudate and promote a moist environment, facilitating wound healing. 51. A nurse is caring for a patient with a superficial burn injury. Which of the following interventions is most appropriate for pain relief? A. Apply ice to the burn area. B. Administer prescribed pain medication. C. Soak the burn in cool water for 30 minutes. D. Wrap the burn in a dry dressing. Answer. B. Administer prescribed pain medication. Rationale. Pain management is crucial for burn care. Ice can cause further tissue damage, and soaking the burn for too long can lead to hypothermia. A dry dressing is appropriate for protecting the burn, but not for pain relief. 52. A nurse is assessing a patient's pressure ulcer and notes that the ulcer has a red, moist wound bed with granulation tissue. Which stage of pressure ulcer is this? A. Stage I. B. Stage 2. C. Stage 3. D. Stage 4. Answer. C. Stage 3. Rationale. Stage 3 pressure ulcers involve full-thickness tissue loss with visible fat, and granulation tissue is often present. Stage I involves redness. Stage 2 shows partial thickness skin loss, and Stage 4 involves exposure of muscle or bone. 53. A nurse is caring for a patient with a large wound that is not healing as expected. Which of the following factors is most likely to delay wound healing? A. Adequate nutrition and hydration. B. Chronic diseases such as diabetes. C. Regular repositioning of the patient. D. Use of appropriate dressings. Answer. B. Chronic diseases such as diabetes. Rationale. Chronic diseases, particularly diabetes, can impair circulation and immune function, delaying wound healing. Proper nutrition, hydration, repositioning, and appropriate dressings promote healing. 54. A nurse is caring for a patient with a wound infected with methicillin-resistant Staphylococcus aureus, MRSA. Which of the following precautions should the nurse follow? A. Standard precautions. B. Airborne precautions. C. Droplet precautions. D. Contact precautions. Answer. D. Contact precautions. Rationale. MRSA is transmitted through direct contact, so contact precautions should be followed to prevent spread. Airborne and droplet precautions are used for other infections. 55. A nurse is caring for a patient with a wound that has excessive moisture and requires frequent dressing changes. Which dressing type would be most appropriate? A. Foam dressing. B. Hydrocolloid dressing. C. Transparent film dressing. D. Alginate dressing. Answer. A. Foam dressing. Rationale. Foam dressings are highly absorbent and are ideal for wounds with excessive moisture. Hydrocolloid dressings are better for dry wounds, while transparent film is used for protection, not absorption. 56. A nurse is caring for a patient with a wound on the lower leg. The wound has a pale, dry appearance with minimal exudate. Which of the following dressings is most appropriate? A. Hydrocolloid dressing. B. Foam dressing. C. Transparent film dressing. D. Alginate dressing. Answer. A. Hydrocolloid dressing. Rationale. Hydrocolloid dressings are ideal for dry wounds with minimal exudate because they help maintain a moist environment, promoting healing. Foam and alginate dressings are better for exudative wounds. 57. A nurse is caring for a patient with a stage I pressure ulcer. Which of the following interventions is most appropriate to prevent the ulcer from worsening? A. Reposition the patient every 2 hours. B. Apply a hydrocolloid dressing. C. Keep the wound dry to prevent infection. D. Massage the surrounding area. Answer: A. Reposition the patient every 2 hours. Rationale: repositioning every 2 hours helps relieve pressure and prevent the ulcer from progressing. Hydrocolloid dressings are more appropriate for deeper ulcers. Massaging can damage tissue. 58. A nurse is caring for a patient with a surgical wound. Which of the following is the most important factor in preventing wound infection? A. Keeping the wound dry at all times. B. Using sterile technique when changing the dressing. C. Encouraging the patient to ambulate early. D. Ensuring adequate pain control. Answer: B. Using sterile technique when changing the dressing. Rationale: sterile technique prevents contamination and infection. Keeping the wound dry is important, but does not replace sterile dressing changes. Early ambulation and pain control are supportive, but not primary interventions. 59. A nurse is caring for a patient with a wound that is not healing as expected. Which of the following lab values would be most important to monitor? A. Blood glucose levels. B. Hemoglobin levels. C. Platelet count. D. White blood cell count. Answer: A. Blood glucose levels. Rationale: elevated blood glucose can impair wound healing and increase the risk of infection. Hemoglobin and platelet levels are important for overall health, but glucose control is critical for wound healing in diabetic patients. 60. A nurse is caring for a patient with a stage 4 pressure ulcer. The wound has exposed bone and is showing signs of infection. Which of the following interventions is most appropriate? A. Apply a foam dressing. B. Perform sharp debridement. C. Administer oral antibiotics. D. Apply a hydrocolloid dressing. Answer: B. Perform sharp debridement. Rationale: sharp debridement is necessary to remove necrotic tissue, and signs of infection require appropriate intervention. Foam dressing is helpful, but debridement is the priority for this deep, infected ulcer. 61. A nurse is preparing to change the dressing on a patient's wound. The wound is draining copious amounts of exudate. Which dressing would be most appropriate for this wound? A. Transparent film dressing. B. Hydrocolloid dressing. C. Foam dressing. D. Gauze dressing. Answer: C. Foam dressing. Rationale: foam dressings are highly absorbent and suitable for wounds with copious exudate. They help manage moisture while promoting a moist wound environment for healing. 62. A nurse is caring for a patient with a pressure ulcer and notices that the surrounding tissue is red and warm to the touch. What should the nurse do first? A. Apply an antimicrobial ointment to the ulcer. B. Notify the healthcare provider. C. Cleanse the wound with antiseptic solution. D. Increase the frequency of repositioning. Answer: B. Notify the healthcare provider. Rationale: redness and warmth around the ulcer may indicate infection or inflammation. The healthcare provider should be notified to assess and provide appropriate treatment. 63. A nurse is caring for a patient with a surgical wound and notices that the edges are not approximated. What is the most appropriate action? A. Apply a hydrocolloid dressing. B. Assess the wound for signs of infection. C. Notify the healthcare provider. D. Apply a transparent film dressing. Answer: C. Notify the healthcare provider. Rationale: if the wound edges are not approximated, there may be a risk of dehiscence. The healthcare provider should be notified to evaluate and manage the situation. 64. A nurse is caring for a patient with a stage 2 pressure ulcer. Which of the following is the most appropriate dressing to promote healing? A. Hydrocolloid dressing. B. Gauze dressing. C. Foam dressing. D. Transparent film dressing. Answer: A. Hydrocolloid dressing. Rationale: hydrocolloid dressings are ideal for stage 2 pressure ulcers because they maintain a moist environment and promote healing by allowing granulation tissue to form. 65. A nurse is caring for a patient with a wound that has a significant amount of eschar. Which of the following interventions should the nurse implement? A. Apply a foam dressing. B. Perform debridement. C. Apply a hydrocolloid dressing. D. Increase the patient's protein intake. Answer: B. Perform debridement. Rationale: eschar is dead tissue that must be removed for proper healing. Debridement is necessary to promote healing and prevent infection. 66. A nurse is assessing a patient with a wound that is healing by secondary intention. Which of the following findings would be expected? A. The wound edges are approximated. B. The wound is covered with a scab. C. The wound has a thin layer of granulation tissue. D. The wound is covered with dry, necrotic tissue. Answer: C. The wound has a thin layer of granulation tissue. Rationale: healing by secondary intention involves the formation of granulation tissue, which is pink and moist. Wounds that heal by primary intention have edges that are approximated. 67. A nurse is caring for a patient with a surgical wound and notices that the wound has purulent drainage. What is the most appropriate nursing action? A. Cleanse the wound with hydrogen peroxide. B. Administer prescribed antibiotics. C. Apply a hydrocolloid dressing. D. Notify the healthcare provider. Answer: D. Notify the healthcare provider. Rationale: purulent drainage is indicative of infection. The healthcare provider should be notified to assess the wound, prescribe antibiotics, and determine the need for further interventions. 68. A nurse is caring for a patient with a stage 3 pressure ulcer. The wound bed is covered with necrotic tissue. Which of the following treatments is most appropriate? A. Apply a hydrocolloid dressing. B. Perform sharp debridement. C. Administer antibiotics. D. Apply a foam dressing. Answer: B. Perform sharp debridement. Rationale: sharp debridement is necessary to remove necrotic tissue in order to promote healing. Hydrocolloid dressings are not used for necrotic tissue, and antibiotics may be needed if infection is present. 69. A nurse is caring for a patient with a pressure ulcer. Which of the following interventions is most important to prevent further skin breakdown? A. Maintain adequate nutrition and hydration. B. Perform daily dressing changes. C. Increase the frequency of wound assessments. D. Apply a hydrocolloid dressing. Answer: A. Maintain adequate nutrition and hydration. Rationale: adequate nutrition and hydration are essential for tissue repair and prevention of further skin breakdown. Wound assessments and dressing changes are also important, but nutrition is a priority. 70. A nurse is caring for a patient with a diabetic foot ulcer. Which of the following is the most important intervention to promote healing? A. Maintain tight glucose control. B. Apply an antimicrobial dressing. C. Keep the foot elevated. D. Administer oral antibiotics. Answer: A. Maintain tight glucose control. Rationale: maintaining tight glucose control is essential in promoting wound healing in diabetic patients. Elevated glucose levels can impair immune function and delay wound healing. 71. A nurse is caring for a patient with a pressure ulcer that is not healing. Which of the following factors could contribute to delayed wound healing? A. Increased protein intake. B. Chronic steroid use. C. Regular repositioning. D. Adequate hydration. Answer: B. Chronic steroid use. Rationale: chronic steroid use can impair immune function and delay wound healing. Increased protein intake, regular repositioning, and adequate hydration generally promote healing. 72. A nurse is caring for a patient with a wound that is healing by tertiary intention. Which of the following would be expected? A. The wound edges are not approximated. B. The wound is left open to air. C. There is a delay in wound closure. D. The wound heals without scarring. Answer: C. There is a delay in wound closure. Rationale: tertiary intention involves a delayed closure of a wound, often due to infection or complications. The wound may initially be left open and then closed once the risk of infection is resolved. 73. A nurse is caring for a patient with a burn injury. The nurse notices that the wound is red, swollen, and painful. What is the most appropriate intervention? A. Apply ice to the burn. B. Administer prescribed pain medication. C. Soak the burn in hot water. D. Apply an antibiotic ointment to the burn. Answer: B. Administer prescribed pain medication. Rationale: pain management is a priority for burn patients. Ice and hot water can cause further tissue damage, and antibiotic ointments are not appropriate unless infection is present. 74. A nurse is caring for a patient with a stage I pressure ulcer. The ulcer is red and intact. Which of the following is the best intervention to prevent the ulcer from worsening? A. Apply a transparent film dressing. B. Reposition the patient every 2 hours. C. Apply a hydrocolloid dressing. D. Massage the surrounding area. Answer: B. Reposition the patient every 2 hours. Rationale: repositioning every 2 hours relieves pressure on the affected area, preventing the ulcer from worsening. Transparent film dressings are used for more advanced stages. 75. A nurse is caring for a patient with a wound that is draining serous fluid. Which of the following dressings would be most appropriate? A. Hydrocolloid dressing. B. Transparent film dressing. C. Foam dressing. D. Alginate dressing. Answer: B. Transparent film dressing. Rationale: transparent film dressings are ideal for wounds with minimal drainage, such as those draining serous fluid. They protect the wound while allowing for oxygen exchange. 76. A nurse is caring for a patient with a wound infection. Which of the following signs would indicate that the infection is improving? A. The wound becomes more painful. B. The wound becomes red, swollen, and warm. C. The wound begins to drain purulent fluid. D. The wound has less drainage and becomes less red. Answer: D. The wound has less drainage and becomes less red. Rationale: a decrease in drainage and redness indicates that the infection is resolving. Pain, redness, swelling, and purulent drainage indicate ongoing infection. 77. A nurse is caring for a patient with a pressure ulcer. Which of the following would be most helpful in promoting healing? A. Keeping the wound dry at all times. B. Using a hydrocolloid dressing to maintain a moist environment. C. Increasing the frequency of repositioning. D. Administering antibiotics. Answer: B. Using a hydrocolloid dressing to maintain a moist environment. Rationale: hydrocolloid dressings promote a moist wound environment that supports healing. Repositioning and antibiotics may also be needed, but maintaining moisture is crucial for healing. 78. A nurse is caring for a patient with a large, draining wound. The nurse notices that the wound bed is yellow and contains slough. Which of the following actions is most appropriate? A. Apply a hydrocolloid dressing. B. Perform debridement. C. Apply a foam dressing. D. Apply a transparent film dressing. Answer: B. To perform debridement. Rationale: slough is non-viable tissue that needs to be removed for proper healing. Debridement will help promote granulation tissue formation. 79. A nurse is caring for a patient with a stage 2 pressure ulcer. Which of the following is the most important intervention to promote healing? A. Apply a foam dressing to the ulcer. B. Administer prescribed antibiotics. C. Increase the patient's protein intake. D. Apply a hydrocolloid dressing to the ulcer. Answer: D. Apply a hydrocolloid dressing to the ulcer. Rationale: hydrocolloid dressings are ideal for stage 2 pressure ulcers because they maintain a moist wound environment, which promotes healing. 80. A nurse is caring for a patient with a wound that is healing by primary intention. Which of the following findings would be expected? A. The wound is filled with granulation tissue. B. The wound has a scab over it. C. The wound edges are approximated, and there is minimal scarring. D. The wound is left open to air for several days. Answer: C. The wound edges are approximated, and there is minimal scarring. Rationale: primary intention involves the wound edges being closely approximated, which leads to minimal scarring. Granulation tissue and scabs are more common in secondary intention.